Hello everyone. Today, we're delving into the world of a medication called Naltrexone, commonly known by its brand name, Vivitrol, or its generic name. As always, our discussion is intended for educational purposes only. If you have health-related questions or concerns, it's important to reach out to a medical professional. Description: Naltrexone, known as Vivitrol in its branded form, is a medication available in various formulations, including oral tablets and extended-release injections. It belongs to the class of drugs known as opioid antagonists. Naltrexone works by blocking the effects of opioids in the brain, thereby reducing cravings and preventing the euphoric effects of opioid drugs. Approved by the FDA, it's primarily used in the treatment of alcohol and opioid dependence. Naltrexone can also be beneficial in managing addiction to opioid drugs, including heroin and prescription painkillers. Additionally, it's been explored for its potential in reducing cravings in individuals struggling with compulsive behaviors, such as those related to gambling or binge eating disorder. Warnings: before starting Naltrexone, it's important to consider certain precautions. This medication should not be used by individuals currently using opioids, as it can precipitate withdrawal symptoms. It's crucial to be opioid-free for a certain period before initiating naltrexone therapy. Additionally, those with acute hepatitis or liver failure should avoid naltrexone, as it can exacerbate liver function abnormalities. Individuals with a history of hypersensitivity to naltrexone should also refrain from its use. As always, it's essential to discuss your medical history and any potential risks with your healthcare provider before starting naltrexone. Before taking this medicine. Before beginning naltrexone treatment, it's important to inform your healthcare provider of any medical conditions you have, including liver problems or hepatitis, as well as any medications you're currently taking, including prescription drugs, over-the-counter medications, and supplements. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to discuss the potential risks and benefits of naltrexone with your healthcare provider. Regular monitoring and follow-up appointments are typically recommended to ensure the medication's effectiveness and safety. Side effects: like all medications, naltrexone can cause side effects. Some individuals may experience gastrointestinal symptoms such as nausea, vomiting, or abdominal pain. Others may report headaches, dizziness, or fatigue. In rare cases, more severe side effects such as liver toxicity or allergic reactions may occur. If you experience any unusual symptoms while taking naltrexone, it's important to seek medical attention promptly. Interactions: naltrexone may interact with certain medications, including opioid pain medications, certain antidepressants, and drugs that affect liver enzymes. It's crucial to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any potential interactions. Dosage: the correct dosage of naltrexone is essential for its effectiveness. Dosage and administration may vary depending on the formulation and the individual's specific circumstances. Typically, oral naltrexone is started at a lower dose and gradually increased under medical supervision. Extended-release injections are administered by healthcare professionals at specified intervals. It's important to follow your doctor's instructions carefully and not to adjust your dosage without consulting your healthcare provider. Avoid: while taking naltrexone, it's advisable to avoid opioid drugs, including prescription painkillers and heroin, as they may be ineffective and can lead to withdrawal symptoms. Alcohol should also be avoided, as combining naltrexone with alcohol can increase the risk of liver damage. Additionally, driving or operating machinery should be approached with caution, especially initially, as naltrexone may cause dizziness or drowsiness in some individuals. FAQ: many individuals wonder about the duration of naltrexone treatment. Treatment duration can vary depending on individual circumstances and treatment goals. It's essential to follow your doctor's recommendations and attend regular follow-up appointments to assess progress and determine the appropriate duration of therapy. Closing: that concludes our overview of naltrexone. Remember, this information is provided for educational purposes and should not substitute professional medical advice. If you have any questions or concerns about naltrexone or its use, don't hesitate to consult with a healthcare provider. Thank you for joining us.